Hey Freedom Lovers, this is Dr. Peterson Pierre with America's Frontline Doctors bringing you today's Daily Dose. Blood pressure medications are some of the most overly prescribed medications. Over 70% of adults 60 years and older have high blood pressure, and over half of those take blood pressure medication to prevent heart attacks and strokes. For those who don't need blood pressure medication, taking these drugs may do more harm than good. Older adults have a higher risk of adverse drug reactions and side effects when taking multiple medications, also known as polypharmacy, as their ability to absorb and eliminate drugs is often impaired. Taking people off these drugs can help reduce the risk of side effects like dizziness and falls and potential interactions associated with polypharmacy. Published in JAMA Network Open on November 25th, a new study found that discontinuing nursing home residents' blood pressure medications or reducing their dosage by at least 30% did not lead to hospitalization for heart attack or stroke after 2 years, compared to those who continued taking their prescriptions. Researchers analyzed electronic health record data for long-term VA residents aged 65 and older. These residents were taking at least one blood pressure medication. Nearly 18% of the roughly 13,000 residents had their medication reduced in dosage or frequency for at least 2 weeks. Researchers monitored these residents for 2 years, finding no significant difference in the risk of hospitalization for heart attack or stroke between those who reduced or discontinued their medication and those whose prescriptions remained unchanged. A 2015 investigation found that people with particularly low blood pressure and those taking multiple blood pressure medications face more than double the risk of death compared to others with high blood pressure, highlighting the dangers of overtreatment in frail populations. The new study reported that these findings contrast with an earlier Cochrane review. Cochrane is a British nonprofit recognized as the highest standard of evidence-based healthcare. The review suggested that stopping or reducing blood pressure medications increased the risk of heart attack by 86% and stroke by 44%. However, the authors stated that the review had weak evidence, noting that the included studies were low quality, had short follow-up periods, focused solely on discontinuation of diuretic antihypertensive medication, and were conducted over 20 years ago. Ladies and gentlemen, only the truth will set you free. Stay tuned for the next Daily Dose.